Now we get on to a different topic. It's acne. Acne is a chronic inflammatory disease of the pyrosebaceous unit. It is very common during adolescence. It fluctuates in the number and the severity of lesions, and it has a characteristic distribution. You see acne on the face, neck, especially on the posterior aspect, upper back, anterior chest in V form, in V pattern from the shoulders to the sternum and on the shoulders. The common side is the face. What are the types of acne lesions? There are comedones. Two types of comedones are there. One is open comedones, or we call blackheads. The other one is closed comedones, or we call them whiteheads. And there could be erythematous papules and pustules, or papulo-pustular lesions. And there are deep cystic lesions, or tender nodular cystic lesions. And again, on the acne lesions, after the lesions resolve, you will end up with scars. They may be small, deep ice pick scars. This is a lady with acne, where you can see the nodular cystic lesions, comedones, papules, and post-inflammatory pigmentation, as well as scars on her cheek, forehead, and the chin. This is the lady with severe acne, with multiple lesions all over her face, with crusted papular pustules, nodular cystic lesions. Again, the same lady on the other side of her face. What is the pathogenesis of acne? It's mainly due to 4 reasons. Not the exact one cause, it's a combination of several factors. Because acne comes during the adolescence, it's due to androgens, usually normal amounts, which stimulates increased sebum production. The other cause is hair follicles with particularly large sebaceous glands, which are located on the face, neck, chest, and back. They become blocked by hyperkeratosis. This results in the closed comedones. Within the follicle, an obligate anaerobe called Propionibacterium acne proliferates. This organism acts on the sebum, releasing inflammatory chemicals. This leaks into the surrounding dermis. The body mounts an intense acute inflammatory response, which results in the formation of papules, pustules, and nodules. So comedones are due to blocking of the hair follicle with the hyperkeratotic debris. But the inflammatory papules, pustules, and the nodular cystic lesions are due to the Propionibacterium acting on the sebaceous glands, which causes inflammatory reaction, which leads to the inflammation in the dermis. Treatment for acne, it depends on the severity of acne. If it is sort of few lesions or mostly comedones, you can try the topical treatment. The topical treatments consist of benzyl peroxide, either the 2.5% or 5%, retinoids, isotretinoin, tretinoin, adapalene, or the topical antibiotics in the form of clindamycin, erythromycin, or there are combination products like benzyl peroxide antibiotic combination, or retinoids and antibiotic combination, or benzyl peroxide and retinoid combination, which gives better results. In the case of severe acne, like where you have a lot of inflammatory acne with papular pustules, nodular cystic lesions, then those patients should be offered with oral antibiotics, either the tetracycline, doxycycline, or minocycline, or oral isotretinoin if it is very severe. You can offer cyproterone acetate as well. I have mentioned surgical intervention here, that is mainly for the scarred acne. What are the types of acne? The classical acne vulgaris, which occur on the face, which comes in adolescents. Then there is infantile or juvenile onset acne, which usually seen during infancy, or the late onset acne, which comes after 35 to 40 years of age, or acne severe, we call acne conglobata, where you see multiple nodular cystic lesions on the face as well as on the trunk. In severe form, which is rare, it can come with systemic symptoms where we call it acne fulminans. Acne excoriate, where you see a lot of excoriated lesions, that is due to the manipulation. They traumatize the skin. Secondary acne seen in several conditions, like in PCOS, or it could be secondary to drugs. Secondary acne, it's usually endocrine associated. The most common is polycystic ovary syndrome, where you see acne, hirsutism, menstrual irregularities, infertility, sometimes obesity. The other cause of secondary acne is medicaments, usually topical greasy ointments, pomades, topical steroids. That is very common nowadays because most of the whitening agents, it includes topical steroids. Though it causes whitening of the skin, unwantedly you will experience acne coming on the face. Acneiform lesions secondary to drugs, systemic steroids, phenytoin, isoniazid, and lithium. And lastly, the mineral oil induced acne.